The Foundation for Accelerated Vascular Research presents the 12th Wylie Scholar, Dr. Ulka Sachdev.
What I like about doing basic science research is I really like the process of asking the questions and then trying to flesh out a way to answer them.
Ulka was recruited to join us because of her deep interest in pursuing a career in basic research along with clinical vascular surgery.
She was clearly very excited about basic science research, and this is something I wanted to promote more in our division.
The Division of Vascular Surgery in Pittsburgh is probably one of the best in the country under the leadership of Dr. Macaroon. Pittsburgh happens to be a place where the surgical department and the institution as a whole values basic science research and really supports the creation of the surgeon scientist.
She's already demonstrated that she is going to excel in this career path in her research because she has made it happen.
HMGB1 is a nuclear protein that is found in almost all cells. And we know that in cells that are stressed because they're dying, it can be released. And once it's released, there is a fair amount of data to suggest that HMGB1 can initiate a significant inflammatory response in the body. What's not really known, but is an intriguing idea, is whether this particular molecule may have a role in initiating angiogenesis, or the formation of new blood vessels in tissue that has lost its blood supply. This is an idea that was actually conjured up by my mentor, and together we kind of worked out the details of how we would study this.
And that actually was very important to me because I have a similar interest in vascular biology, and so it was very appealing to have a partner who could share my interest.
We've been producing some very interesting data to suggest that HMGB1 may actually have a very important role in angiogenesis. Clinically, it's important because patients who have poor blood supply to their legs, who cannot get a bypass or cannot get a stent to restore that blood flow, are at very high risk for amputation and limb loss. And so it's important to try to investigate all of the mechanisms that may help promote native blood supply to be developed, and it may ultimately have some role in helping patients who cannot get a bypass.
Well, for Ulka, this is really a very important award that comes at a critical time in her career because it validates the efforts that she has been putting so far in developing her line of research in the lab.
The Wylie Award has a tremendous impact for me. It allows me to continue this research and allows me to do some fairly complex experiments to try to flesh out this idea and try to understand how HMGB1 is involved in angiogenesis.
Actually, Ulka is the second recipient of this award in our division, and her mentor, Dr. Zhang, received it many years ago, and that was quite critical actually in her career development too.
She's only completed the second year of her faculty appointment, and she's already been extremely productive.
The Wylie Scholarship allows me to get the support that I need really to continue the research and hopefully eventually apply for NIH funding.
So this is really an excellent mechanism for vascular surgeons to develop, and we are very gratified that Ulka has got it.
My husband and I were medical students together at Mount Sinai. That's where we met. Right now he is currently doing both pediatric and adult urology here in Pittsburgh. And we have 2 young children. My daughter is Lila, her name is Lila, and she is 6, and my son is Jathan, and he is going to be 2 in September. In 10 years, I see myself pretty much doing what I'm doing now, which would be maintaining a clinical practice to be able to continue to take care of patients and to be able to continue to be involved in work that generates research questions. I think the process of basic science is really important in even how you address clinical questions. I think it makes the experience of clinical treatment bigger.
She's got incredible motivation, and I think that her career in the future will be extremely successful as far as independent research.
We'll try to keep her here for a long, long time.